Okay, so who does the advocate advocate for? Right. Obviously, the advocate is there for the patient. The advocate is there for the person who has a medical diagnosis that we're trying to navigate through and figure out how to live life as best as we can. The thing is that in order for that patient, that person who has this diagnosis, whatever that might be, to live their best life, the people who are around them, they need to be too, right? The person who's ill, they need their support system. They need their support system, and they need you to be on top of your game. And I've I've often said to patients' family members, look, sometimes I think that this is harder for you. I think it's harder for the family member to see their loved one suffering or to see their loved one in need. Um, and so I see a private advocate as obviously being there for the person who needs the care, who needs, their blood sugar checked or their blood pressure checked or whatever they need, but it also encompasses the people who are closest to them. So what does a private healthcare advocate do for those people, right? Well, what we can do is give you some peace of mind, right? It's hard when you're the only one who's making the decisions. It's hard when you're getting all of this information and your emotions are tied to it, right? So your loved one is ill, or has this chronic disease, and so their job is just to heal or to get better or to live as best as they can. And then there's you, and you're making decisions. And it's like, who do you have to bounce things off of? Well, sometimes your emotions get in the way and it's too hard to be able to step back. So as a private advocate, I can give you a little peace of mind, right? And somebody else to be there for you and on your loved one's side without the emotions tied to it. There's a convenience level, right? If I'm here for you, I'm here for your loved one. I can help you get to where you need to get to. I can check to make sure that they're doing okay at home. There's a convenience level to that. It's someone else to bounce ideas off of and bounce issues off of. It's someone else to help you with problem solving. There's some practical help. Obviously, I already talked about transportation, acting as a liaison between your loved one, you, and their physician. That's something to be able to kind of get through the. Just sometimes it's murky getting through to talk to a physician and let them know exactly what's going on. And you're a private advocate who knows your loved one, the patient, or you, and is able to communicate. That is very helpful, right? And just easing the burden, not that your loved one is a burden, but like, man, it's kind of nice to have someone else to help shoulder this with you, right? Like, Jesus tells us to shoulder each other's burdens, to help with each other's burdens. And that's for the patient, that's for their loved ones. So I'm here for all of you.